Happy Friday, Baylor College of Medicine and friends of Baylor. So, of course, all the news is J&J. So my sister called me and she wants to know what is the impact of the pause with J&J on her walks in Riverside Drive. I have no idea. Why do you even ask me stuff like that? Anyway, her friends want to know if they can still go out because they paused J&J. I have no idea. For those of you who did not see last week Lily's highlights hitting the winning shots, I just want to reassure you that I've talked with her and her agent. She's not going pro this year, and she still has 2 more years of eligibility. So I'm thinking the Baylor Bears are looking pretty good for the next couple of years. So, of course, the big news is J&J was on pause. And, of course, I think the Advisory Committee on Immunization Practices met this past week to advise the CDC. And I think they're doing the right thing. I think that it's appropriate to pause, and they're going to wait and see what happens. And I think it's the right thing to do because it is pretty clear that there's something weird going on. So what's reported is 6 women between the ages of 18 and 48 got this kind of strange syndrome, which is cerebral venous sinus thrombosis, and we'll talk a little bit about that. That's very rare disorder, and occasionally it's a clot where the blood exits the brain. The unusual thing about this is that the platelet count was also reduced, so it's acting as though it's an immune response to the platelets that's potentially generated by the vaccine. And because it's the Johnson & Johnson vaccine and the AstraZeneca vaccine, it would seem it might be the vector, the adenovirus vector. So it's reasonable to wait and see what happens. If you want to know how, this is a very rare disease. It happens very rarely, 3 or 4 in a million. What happened, though, is there were 6 cases in 7 million doses of vaccine. The problem is 7 million people weren't in the ages of 18 to 45, and the people who got this were young women. So that denominator is more like 1.5 million. So 6 cases in 1.5 million, you'd say maybe 2 or 3 in a million. So that's still pretty rare. But when they look at how often it happens in women spontaneously, it's 2 or 3 times more than you would expect. So that's why they're concerned it might be something related to the vaccine. And I think it's pretty appropriate that they pause. In addition to that, with the Johnson & Johnson vaccine, 50% of the entire doses that have been given have been given in the last 2 weeks. And this happens only within 2 weeks of the vaccine. So it makes all the sense in the world to wait and see what happens. In addition to that, there was 1 male that got it during the randomized trial. And in the AstraZeneca trials in Europe, there were some men. And so I think it's reasonable to wait and see, particularly since we're trying to use this in younger and younger people. You have to always remember, though, the case fatality rate of COVID is very, very high. It's in the same million people, you'd expect almost 5,000 deaths, and overall, with a 0.5% mortality. But in the younger women in that 18 to 50 range, it's still 150 per million. So you're comparing 150 million deaths from COVID to maybe 1 or 2 per million complications to the virus. But the good news is we have other vaccines. The mRNA vaccines have not been associated with this, and so that's one option, although it would slow us down. And the other thing I take very positively from this is we have never really had a vaccine surveillance for complications as robust as we have now. So we picked up the signal very quickly, and I think that should make everyone pretty confident, at least. So, every week we do a lot of data review, and you get to hear all that, but people send in questions all the time. And so we like to pause every few months and just take your questions and do a Q&A. And so that's what we're going to do today. So I'm going to start off with the questions I got around the Johnson & Johnson vaccine. People have asked, well, I got the vaccine, and what do I do now? Well, if you do nothing, you're doing fine. If you're fine, it's great. congratulations, you're vaccinated. Now, if you got it within the last 2 weeks and you're a woman between 18 and 45, I'd be sure to be cautious around, I'm feeling okay. And if you have a symptom, report it. But I think, once you've had the vaccine and you're fine, it's all good. One of the questions people asked is, I did get infected. I know I should get vaccinated, but is there any protection against reinfection? The Lancet had a great study. It showed that being infected lowers your risk of getting infection, again, by 85 to 90%. So it's almost as effective as being vaccinated. But again, the reason why we want you to get vaccinated, even though you've been infected with the virus, is you don't have the same levels of antibody to the spike protein, and getting a booster shot to that will hopefully keep you free of virus much longer. So this is one I get all the time. I've been vaccinated. Can I go to the gym? Can I go to the grocery store? How about eating in a restaurant indoors? Can I get my hair cut? How about a dentist? Can I go to the dentist, for God's sake? So the answer is yes, 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 yes. Oh, yeah, and yes, you can do all those things. I would not go to the bar with 100 people in it. I wouldn't go to the body slamming contest. I'd stay out of mosh pits. I wouldn't go to any place where you assemble 50, 60,000 people and cram them all together. And the reason for that is we still know you can pick up virus, and even though it's a rare event, you might be able to transmit it to others. So I don't think we're at the point yet with the amount of virus in the community that we can rip off our masks and say, hallelujah, all is well. I think we're at the point where you can do relatively normal things with small amounts of people, small gatherings, but I would still stay out of, giant gatherings where you might be exposed to virus, and you might expose others once you leave that place. People have asked me about traveling. As I said before, it's easy. You can travel by airplanes domestically. You can leave the country if they'll let you in. Europe won't let you in. Canada won't let you in. But when you come back, you're going to get tested because you might have picked up a variant, even though it won't make you sick. You might be carrying one, and so you'll be tested to make sure that you're not bringing something into the country. And one of the things about being vaccinated, I went through the data the last couple of weeks. This vaccine, the RNA vaccines, are really effective in real world conditions. So normally we do a study under very controlled conditions, and we get a very reasonable percentage of protection. You put people out, and it doesn't work as well because they expose themselves in many other ways, not like you're in the study. But there's been a bunch of studies that showed it's really, really effective. There was a CDC report last week. Only 1 in 1,000 first responders who had been vaccinated got infected versus 161 in the unvaccinated group. I talked about the healthcare workers at UCSD and UT Southwestern. Almost nobody gets infected. So, it's really, really effective. And that's why you should feel confident that if you're fully vaccinated 2 weeks after your vaccine, you should be able to go around. Now, I would caution you on one thing. Be socially aware, because there are people walking around you who may want the vaccine but haven't gotten vaccinated yet. So wear your mask. Don't be that person who's going, I've been vaccinated, so I'm not wearing my mask. Don't be that person. Be socially reasonable, socially acceptable. Wear your mask when you're in groups. Take it off when you go to the restaurant. Wear your mask wherever you go. Take it off when you go to the restaurant. But once we get towards the point where, everyone who has gotten the vaccine, who wants the vaccine, I think we will be able to take our masks off and walk around normally. I would anticipate more like in the fall for that. Got questions about young people. Why are young people being hospitalized now? Well, as I mentioned last week, the CDC reported 37,000 kids have been hospitalized under the age of 4, and over 100,000 kids have been hospitalized between 4 and 15. So they've been getting hospitalized. It's a very small percent compared to the adults, but it's still a lot of kids. But the new variants seem to be worse for younger people. So the UK variant seems to have a higher number of kids being infected. That's true in Michigan. And the Brazilian variant in particular seems to have a big impact on younger people. So the ICU admissions for teenagers was 3-fold higher, and for people under 50 was 6-fold higher. So the variants seem to be driving that issue. When will children be vaccinated? Well, hopefully soon. The Pfizer study is underway. They're starting with 16 and 17-year-olds, and once they have some safety data, they're going to keep going down. I hope that we have data on that by a month or two so we can start vaccinating teenagers and hopefully kids younger than that by the fall. Do young people need to be vaccinated since they're at low risk? Yes. As I mentioned, they're low risk, but they get disease. Plus, they don't want to be carrying disease, and they can infect family members. So, yes, they should be vaccinated once it's proved to be safe. Let me emphasize, once it's proved to be safe, they should get vaccine. What is the expected date? Same kind of thing, late summer. Will it be possible for all students to return to school in person in the fall? I think it will. I think once the teachers are vaccinated and we start vaccinating kids, I think it will be. I think it will. And I was very proud to see that in New York they set aside a hunk of vaccines for kids in college. I've been pushing this. Some governor finally listened to me. I would love to get all the kids to go to college vaccinated. That would be a great thing. That would lower the disease burden significantly. Now here's some important questions. Can the vaccine cause COVID? What? I mean, at times you got to wonder. The answer is no. It's not a live virus. It only is it's a read-only file. It goes in. All you can do is read it. It can't replicate. So the answer is no. How can the vaccine be safe since it was so quickly developed? Well, it wasn't so quickly developed. It took 15 to 20 years to get the mRNA technology, and then the liposome development took a long, long, long time. The adenovirus vectors have been in development even longer. Now we're seeing some problems with those. But the mRNA platform has been around a lot, and because there's so much disease, it's very easy to do these clinical studies. Remember, part of the reason things are accelerated, sometimes it takes, if you're doing a study with a drug where there are very few people, it might take 3-4 years to just enroll enough people. With a global pandemic, you can enroll everybody in about 15 minutes because everybody's sick. So part of the speed is really because the clinical trials, which are often the longest part, are really shortened, and because there's so much sickness out there. I mentioned this, but I'm going to mention it again. Does it cause infertility? I got that question last night at dinner from nice people. It does not, absolutely does not cause infertility. It's so bad because that rumor started in Britain. The British Fertility Society came out with a statement saying it does not cause infertility. I had a negative reaction after my first shot. Should I still get the second? Yes. You should absolutely get it. All the studies have been done with 2 shots to get to the antibody level we need to make sure your T-cell immunity is active, and we want it to be as sustained as possible. So you should do that. Is it okay to take Tylenol or Advil before I'm getting shot? Yes. Should I get a vaccine if I have a high natural antibody count? I don't even know what that means, but assuming you got sick once from the virus and you have antibodies, you should still get your vaccination for the reasons I said. Is it safe for pregnant and breastfeeding women? So those studies are underway, but there were a lot of women who got pregnant and were breastfeeding who were all enrolled in the clinical trials, and there were no problems with it, so I anticipate that there will be no problem with that. Okay, do I need to wear a mask after vaccination? We talked about that. If you're fully vaccinated, in theory you're protected, but socially, give it a 3 months before everyone, until there's enough enough people vaccinated, the viral burden in the community is low, cases are down. Slowly, but I have to tell you, I was with a group of people who were vaccinated last night. It's awkward. You don't know what to do. Do you shake hands? Do you do elbows? Do you fist pump? Are you vaccinated? It's weird, but it's the right thing. We'll get through this together. But it's going to be awkward. I'd say keep your mask on in public and then take it off if you know you're only around people who are vaccinated. What is the significance of no COVID-19 antibody detection after vaccine? Well, that's a little weird. You should have had a response. The most important thing is you have a T-cell response. That's even more important than you just have antibodies out there. But if you don't have any antibody response to the vaccination, I talk to my physician because you might need to get another shot or there may be an issue. But that to me is a strange one. Not everybody gets the same level of antibody response, but almost everybody gets some antibody response. Will the vaccine protect against COVID variants? Depends. The mRNA vaccines all protect against all the variants. They're 50% less effective against the South African variant. AstraZeneca, not so much. AstraZeneca doesn't work against the South African variant, but it works fine for the others. Is there a test, like an antibody test, that I can see whether or not I still have antibodies 6 months later? There's not one that's commercially available, but yes, you can measure those. Many of the research labs, we do that. And there was a publication that came out last week that showed that the mRNA vaccines have antibody levels 6 months later. Okay, here's what. Sports teams are getting fans back into the stadium. Is it safe to go? Kind of. If you're vaccinated, you're probably okay. Would I want to go into a stadium with 50,000 people and sit arm in arm? I'm not doing that. But you're probably okay. Again, the danger is less to you than if you're exposed to something and you're carrying virus, you can expose it to others. I know the stadiums are trying to open at 50% capacity. Good luck with that. After you serve enough beers, no one's going to be touching each other. And of course, there's not going to be anybody sick or symptomatic or shouting. There'll be nobody shouting out there. So, I mean, really, to me, it's stupid. But, if you got to go, you got to go. Is it safe to eat inside restaurants if you've been vaccinated? Yes, it is safe to eat inside restaurants. This is a really good question. Is there going to be a COVID vaccine like the flu mist for people who don't like to be poked? Can you inhale it? So there are 3 current trials going on right now to do just that. One in China, one of the Chinese vaccines. One is in a startup in the U.S. And there's one taking the current formulations, the Pfizer vaccine, and seeing whether or not that works. So, I'm sorry, of AstraZeneca inhaled. So there are going to be other formulations, and I think there will be aerosolized vaccines coming out in the next generation. So there's another good one. Is there worry that communicable diseases like flu will return stronger and affect the population more severely once we stop our safety practices? Well, I was talking to my friends. When was the last time you had a cold? I average a cold in the upper respiratory, common cold. I always get one in the fall, and I always get one in the spring, and sometimes I get one in the summer. I got nothing this year. Why? Because we're all washing our hands, wearing masks. And flu just didn't show up this year. So one of the benefits of not shaking hands and being careful about what we do and wearing masks is, for sure, it lowers the general burden of disease. So once we stop doing that and going back to what we are, it'll be a mess again. You can expect your the common cold to return and flu to return as soon as we take our masks off. So one person asked, have we learned anything? I hope so. This is my last pandemic. I'm not doing this again. I've already decided. That's it. I'm not doing this again. I think we learned a lot. I think we learned that science is good. Science got us out of this because, we don't behave well. I think we learned academic medicine is a good thing. Look at all the academic centers stepped up and provided public health support when there wasn't any. I think we learned that we need better public health, and we need more effective public health measures and data analytics and a whole bunch of other things. I think we need to have better communications. I think the communication and role modeling has been kind of a disaster in this year. So I think we need more of that. I think we also learned some things like kids need to be in school. I think one of the big lessons we learned is that we don't want to repeat the experiment of having elementary kids isolated at home. They don't do well. We've lost a lot of almost a year. And I think also that we've seen a lot of mental illness. So, loneliness, isolation, that kind of stuff is not good for people. So I think it's actually been a very, interesting things that we've learned about ourselves as people, as Americans, what we need scientifically. So Yeah, I think there was a lot of things we have learned. Hopefully, we'll take that and do some good out of it. So I also want to end by saying last week we had alumni awards. This is our alumni weekend coming up. And the alumni awards are really to celebrate some of the great alums we have in all of our schools. And I want to congratulate all of them that received awards. And next weekend, we will be having our alumni event. So really excited about that. The alumni are incredibly important to us. They really are people out there that communicate what the school is all about. They communicate our values. So they're really, really important. We appreciate our alumni. Big shout out to them. And I want you all to have a great weekend. We will get through this together, and someday we'll be mask free. So have a great weekend. I'll see you next week.